We are back now with your 17 Health Watch. Mental health affects those from all walks of life, yet in minority communities, speaking up when faced with challenges is not as simple. 17's Sierra Murdoch explains.
July is Minority Mental Health Awareness Month and a time to shed a light on the factors preventing minorities from speaking up about their mental health and alerting others when there is a problem.
Therapy at times, I think, is more culturally normed for sort of middle-class white people, and we want to make sure that our behavioral health services are available to everybody.
Mental illness and mental health issues do not discriminate, yet minorities seek help at a significantly lower rate than their white counterparts. Several factors are to blame, including a fear that the people closest to them will judge.
And we've also kind of kept things in our home, like, you know, what goes on in our home stays in our home. So I think the stigma really comes from just not knowing what does mental health services look like and what does that mean.
The impact of the stigma surrounding mental health in minority communities has a lasting effect on overall health and wellness.
I feel like over the years, since I was 18, I'm 25 now, that I've lacked the emotional support that was needed in order for me to fully recover along this journey.
While education and open conversations can help decrease stigma, some people in minority communities also see the lack of therapists that reflect their own cultures and identities as a deterrent.
We ensure that our staff look like the community we're serving so that people feel comfortable. They know that needing mental health is a universal need.
But those aren't the only barriers to care minority communities face. Fear can also play a role.
He's got a knife! Check. He's got a knife! Get down! Get on the ground! Get on the ground! Get on the ground!
On a national level, there have been several instances where situations have gone awry when people experiencing mental health crises call for help. Here in Kern County, law enforcement is getting ahead of the curve, pairing officers with licensed mental health professionals while on patrol.
We have a clinician that rides with an officer that just focuses on people that have mental health issues.
Eliminating the stigma surrounding mental health is fundamental for closing the treatment gap for minority communities. Mental health is the key to our overall well-being, and with increased awareness and support for those dealing with battles, we can help be a part of the solution. In studio, Sierra Murdoch, 17 News.